Loving.
Helpful.
Journey.
Grace.
Thoughtful.
Care.
Support.
Dignity.
Bert was 57 and I was 52, and we lived a very full life. Never considered end of life. Why should we think of it? It just wasn't in our picture.
My husband, Livio, needed the help when he was diagnosed with cancer.
My family found Good Shepherd when my mom was in rehab, and we were trying to figure out what came next.
When Bert was diagnosed, it never occurred to me or him that this was part of end of life. I was dealing with the situation as a step in how we live. And now, looking back at that, I'm saying, wow, everything I read says that end of life will come sooner. Why didn't someone tell me that? And I would have prepared financially. We would have put many things into place in terms of our house and my security, insurances. That did not happen.
The end of someone's life, the final phase of someone's life is an important and significant part of their life. It's a part of their life to be lived. It's a part of their life where they can expect to be comfortable, and they can expect to find meaning in that part of their life.
We were the first hospice in Massachusetts, started as a local community hospice, and have had community as part of our mission from the very beginning. This just completes the cycle by reaching out to what a community needs, not just clinical care, but to be educated around an area that has become more of a focus, the fact that we do have life-limiting illnesses and that it's okay to actually discuss these things, and that we're more likely to actually have our personal values and wishes around end-of-life care honored if we have discussion, if we have dialogue.
Advances in medical technology have made decision-making around the end of life much more complex and much more difficult. And that's why good communication is so important, because the circumstances, what's going on many different levels, are really what determine what decisions patients and family members are going to feel most comfortable with.
Good Shepherd really helped us navigate that path of all the decisions that had to be made during that time period, the medical, the emotional, psychological, you name it, they helped.
They educated me. The Good Shepherd tried to show me the correct way of doing it.
The purpose of the Good Shepherd Institute is an extension, really, of the long-standing mission and vision of Good Shepherd Community Hospice to help to facilitate good quality end-of-life conversations between family members, communities, physicians, and individuals in order to facilitate better end-of-life experiences.
The Good Shepherd programs have a very broad impact on the library patrons and those who attend. They're free and available through the community. They allow people to talk about and think about things that they would not normally have thought about.
People don't like to talk about death and dying, and so the Good Shepherd Institute will provide an opportunity and forum in a lot of different formats for people to be able to do that, to ask questions and to talk more about what options and choices are available.
Why it's important to talk about end of life? Because it's a liberation, because it gives you peace to talk about it open and not to be fearful about it, and do it more the way you want it to be. You have freedom to decide for yourself.
I feel fortunate to have a resource such as Good Shepherd very close in this community, because we'll all face death eventually, either our own death or the death of a loved one. And knowing that Good Shepherd is out there to turn to in your time of need is an invaluable resource.
We're looking forward to providing more educational opportunities and outreach into the community, doing some media outreach to those who aren't able to come to our community events. We also are doing education with physicians in residency to help them learn about creating better conversations around end of life with their patients and families. We also have our resource library that people can come to do their own research on end-of-life issues. And we do hope to be involved in in our own research, either conducting or helping to fund research into relevant concerns around end-of-life care.
We're all going to be touched by loss and death. It's just inevitable. And to have a go-to setting, a go-to organization where those needs can be met within a community, I just think that this organization is uniquely poised to respond to that need.